I wasn't sure at first what pharmacists could bring, but I was interested particularly to do with their medicine management side and see how they could help us reduce our workload. But when we had the pharmacist come, I was pleasantly surprised. They've done very well. There is definitely a learning curve between the medicines and applying that to general practice and how we work. But once that happened, it has massively helped. They're certainly very good at adding in medicines for us from discharges, signing prescriptions that we don't need to be seeing, and that reduces our workload. But I think the key thing is when they come to do medication reviews, the feedback from the patients is absolutely fantastic. I think some of us GPs would love that feedback. When we started this, we did look at it slightly selfishly. Like most GPs, we're struggling, the hours are going up, and we were hoping that it's going to reduce our workload, and it has done. Nitin sees the pharmacist. He says his own list of medication reviews. He saved us doing home visits. So when it comes to doing home visit medication reviews, which is a difficult population to get, he goes out and does that. It certainly helped with reducing our workload when it comes to adding new medications. He does that. Signing prescriptions, he's coming online and he's doing that. So that is all work that would have traditionally been done by us, is now being sort of transferred under supervision to the pharmacist, and that relationship works well. It's reduced our workload. I think as Nitin is able to do more and more, that effect will become more noticeable. However, the pressures in GP practice have gone up and generally have just been filled with something else. But I'm guessing it means I get to go home a little bit earlier instead of a little bit later. I think it's important for stopping GP burnout. Well, that's massive actually. Part of that is time, because he's got the time to sit and go through it, which with a doctor, they'll come along, we may have shoehorned a medication review into 10 minutes and they'll come with other problems. With the medication reviews with Nitin, he's able to go through lifestyle changes, show them that they're nudging into pre-diabetes, they've got pre-diabetes and trying to avoid becoming diabetic, obesity, all of these things he tackles. It's quite a holistic way that he does that. And he checks their bloods, checks their blood pressure. Interestingly, he's picked up some AFs. So it's worked well. People like that one-to-one, and the fact that there seems to be an interest and they've had time to get through their concerns and go through their medicines. The surprising thing for me was us as doctors would have told patients, this is your medicine for your blood pressure, but a lot of the feedback consistently is, I didn't realise what this medicine was for and how it worked. So actually I think if people understanding their medicines, they're more likely to be compliant. So absolutely. I think the impact's been very good. Certainly patient feedback in his comments is excellent. Yeah. The quality has definitely gone up, because if patients have got time to go through their concerns, they want to go through their medicines, he can hit on things which sometimes are difficult to talk about. If someone's very overweight, mentioning their weight and going through it and trying to motivate them can be difficult. But actually he's very good at tackling that and going through things. Also, it's an additional check. So if we look at paperwork we get from the hospital, so the patient's been discharged on medicines and getting them to marry up, there's an extra pharmacy check. And sometimes the hospital haven't even mentioned they've stopped some medicines. And we're, well, is it on? Are they not on? And it's useful for Nitin to go through. So actually this is a positive medicine for them to be on. This one interacts with that, not so good. So that adds for us a really good quality.
So good.
I like having a pharmacist part of the team. I think they're useful. They're a much better addition. People used to think, well, having practice nurses, and could they really do all these chronic care clinics? And that was quite a novel idea. Actually, I think in sort of 10 years' time, having a pharmacist as part of your team will become quite commonplace. I think you've got to get the right pharmacist who's interested in what they're doing, and we're very lucky. But I think they can add something. It's how you use them. I think certainly using their skills on medicines is the way forward, and then once they've got the confidence, you can probably train them to do lots of other things. So our pharmacist already does our asthma reviews, as well, which has freed up practice nurse time, which was probably an added bonus we weren't expecting. I think Nitin has been great. He's certainly added an element of knowledge to the practice. Patients love him. I think it's worked very well, and we've been pleased to have him.